What is the number that is reached by a geographical area when you, your scientific and medical advisors say, we better press the button on lockdown? What will we get to? Good morning, sir.
Good morning. Well, we don't have a specific number. We look at all of the factors, and across parts of northern England, we've seen the rates of new cases going up over the past few weeks, and they've been stubbornly high in some areas. And the extra thing that we'd seen is that was not just confined to the areas where we had been taking action previously, like in Blackburn, like in Oldham, but we're starting to see a wider rise in the community across Greater Manchester, East Lancs, and these parts of West Yorkshire, and that's why we took the action that we did yesterday.
So it doesn't hit a certain number, just for the purpose of debate. It's not 500 a day or 500 a week that sounds an alarm.
That's right. We do look, of course, at all the statistics, but there isn't a specific threshold because you've got to look at all of the different data.
You're quoted as saying the spread is largely due to households meeting and not abiding to social distancing. How concerned are you that either, candidly, you failed to get the message across to folk in the north, or they're not listening, whichever it might be?
Well, we are worried that from the new information that we've got from our testing and tracing, that the biggest impact in terms of the number of contacts people have when they've tested positive is meeting other households at home and visiting friends and relatives. And much more cases there than in people going to work, and that's why we've taken this very targeted action. I appreciate that it is very, very significant for the people of the area affected. But we're not saying proposing any changes in terms of going to work or in terms of travel, but specifically about meeting other households and other than outside in public places. And I look, my heart goes out, like you were saying just before. My heart goes out to people. I get the impact of this. And not
particularly on a holiday for them as well, for many of those folk.
Particularly on a holiday. And, the thing is that the disease thrives on social interaction.
Yes.
And that's one of the really sad things about it.
But do you understand?
I understand that.
People are confused, Secretary of State. Is it 7 days of self-isolation? Is it 10? Should you go an air bridge or should you not? Can you fly at all? Can you go to a Spanish island? Can you go to the Spanish Main? It's not surprising people are confused, Secretary of State.
Well, what I do appreciate is that we do have to move fast sometimes in order to control the virus, and the vast majority of people are following the rules that we've had to put in place. They're not the sorts of rules anybody would want to put in place, but they do have cross-party support. These changes, and we just try to be as clear as we can. But things do change, and when the virus moves and the impact of it changes, then we do have to update policy.